Okay. Okay, so the next lesson we are going to do is neoplasia. This is the lesson we learn about cancer and tumors. So first, I want to give you some words to remember. The first word is neo. Neo means new. And plasia, as it was done before, it means growth by cell division. So what's a tumor? Let me add that word. What's a tumor? It's an abnormal mass that has grown inside the body. Next, the next word is pleomorphism. So morphism means shape, and pleomorphism means different shapes. Okay, now when it comes to tumor, the mass that has grown can be either a benign tumor or it can be a malignant tumor. So what's the difference between a benign tumor and a malignant tumor? A benign tumor is one which is less dangerous. Usually it does not invade into surrounding tissues or go to other organs, and most of the time you do not need to intervene. So the benign tumors will grow and cause damage by pressure. It will exert pressure on the organ that it's adjacent to. Next, we have the word malignant. Now, malignant tumor is what you call cancer, and this spreads to other organs and tissues. This is very important. Adeno, that prefix, it means glandular. That is tissues of glandular origin. And if you remember histology, you should know that glands are parts of epithelial cells. They are derived from epithelial cells. Next, we are going to learn about why cancer happens, why there is going to be a growth. Two main reasons. One is because there is a loss of inhibition. So in our body, we have these genes which are called oncogenes. So let's take this gene first. These oncogenes are genes which, if even one is activated, it is going to cause uncontrolled cell division. So we have two types. Another type of gene is called a tumor suppressor gene. As the name says, it's going to suppress the growth of a tumor. An example is P53 tumor. Let me explain this again. Let's say there is going to be some sort of stress on the cells, such as radiation, carcinogenic substances, etc. If one of these substances damages the DNA of the cells, and if it causes the activation of proto-oncogenes, which become oncogenes, you just need one to get activated. As you know, we have two alleles. We just need one to get activated. As you can see here, we just need one to get activated, to get upregulated. That is going to cause uncontrolled cell division. The other way is if there is going to be damage to tumor suppressor genes. So these genes stop the formation of cancerous growths, stops cell division uncontrollably, and for that both the DNA, the alleles must be damaged. As you can see, both the genes must be damaged in both alleles. So what is the pathology behind this? It's called uncontrolled mitosis or pathological mitosis. You need to know that. And these tumors can have some function. If those tumors have a function which is closely resembles the normal cell function, it is called a well-differentiated tumor. But if its only function is mitosis, then it's called a poorly differentiated tumor. So if you are to take a benign tumor and a malignant tumor, there's a higher chance that a benign tumor would be more well differentiated. So when it's well differentiated, it doesn't try to grow as fast. It just will look similar to the normal cells, but is actually not. In histology, you can see the difference. You can see it on this diagram here. So you can see, even though over here they look similar to the normal cells, they are not exactly similar on histology, on a biopsy. High grade tumors, you can see they look entirely different from the normal cell, and their cell structure is different because their only function is mitosis. So next, shapes of tumors, benign tumors. It can be a polyp growth, that is growing inside a lumen. It grows inwards to a lumen, and that type of growth is called an exophytic growth. The other type is papillary growth. It looks like a tree. You can get a pedicel similar to a tree trunk, and you get it branching out like this. So that is also a type of exophytic growth because it grows into a lumen. Next, we have nodular growths. Now I'm looking at it from the top, and you can see it expands within its own confinements. It's going to expand outwards. And lobulated is basically something like this. It doesn't have a very clear border. You get lobules on the tumor. And then there's another type called cystic tumors, cystic growth. This is also a type of expansive growth. Now, what is a cyst? It is a fluid-filled cavity, cavity which is encapsulated. There is going to be a capsule. Now, usually benign tumors have a well-defined capsule. So, what is a capsule? You don't need to overthink this. It's basically, if you look at the tissue, you can very clearly see the border between the tumor and the normal tissue. So that's basically what the capsule is. It encapsulates the tumor. Next, malignant tumors. Now the main thing you need to know is it spreads. It grows downwards. So if this is the epithelial layer, it can go outwards and inwards. So if it is like that, we call it a diffuse thickening. There's exophytic growth and infiltrative. It infiltrates the tissues underneath. Then ulcerated growth. That's an infiltrative type where it grows downwards with an ulcer formation which can be seen. Then we have an infiltrating mass. Again, we are looking at it from top, but it grows in all directions. Next, we have the number and size of tumor. So there's a condition called neurofibromatosis. I'll show a picture later. I don't have it right now. But basically, it's a skin tumor, a benign tumor, which grows in all sorts of sizes. These are like lobules which grow all over the body, and it grows in sizes. And then in the ovary, you can get tumors which grow. It can be a single tumor or small tumors. The single tumor can be very large, and so on. So I need you to understand this. You go to the doctor with a mass on your breast. You're afraid, you feel the mass, and you're afraid that it's a cancerous growth. So what the doctor says is, go do an ultrasound. You do the ultrasound, and in the report it says possible tumor, possible malignancy is present. Remember this, that is not the time for you to get afraid or time for you to make life-changing decisions, because until you do a biopsy, what is a biopsy? You take a needle, you insert it and take out some cells. You take out a bit of tissue and then you look under a microscope. A pathologist will be able to determine if this is a malignant tumor or if it's just a benign growth, something like a cyst. So till then you cannot confirm, and if you're a doctor, you should never tell a patient that it's a cancerous growth just based on an ultrasound. You should always do a biopsy before you confirm with a patient that it is a cancer. It could be a benign tumor. If it is a benign tumor, usually you don't do anything much, because usually these are cysts, and you will get, most women will have cysts on their breasts. Next, color of tumors. Most tumors are grayish white because there's cells and fibers involved. If it is yellow, it could be a lipoma, that is lipids. Fat cells are involved in this type, and if it involves blood, it could be red. An example is an hemangioma and melanoma. Melanoma is a type of skin cancer you get due to excess UV radiation, and these cancers are usually black, and it's very highly malignant. I need you to remember that. Melanoma is a very highly malignant tumor. Now, next, a basic components of a tumor. Okay, let me draw this diagram again from the beginning. So first, you have the growing area, the cells which are dividing uncontrollably. That is called the parenchyma. What I have taken here is a papillary growth, and inner to it, you get the mesenchyma or the stroma. Now, what is a mesenchyma? That is basically the framework which holds the tumor and supplies the nutrients to the tumor for growth. Now, this is important. Tumors can show necrosis. There can be necrosis in the tumor, because if the tumor outgrows the formation of the blood vessels, if the tumor is going to grow before the blood vessels can supply blood to these areas, what is going to happen? These cells will die. These cells won't get enough blood, they won't get enough oxygen, and these cells can die. So when they die, they undergo necrosis. I need you to understand that. And then we have the spread of a tumor. How a tumor starts with some sort of stress and undergoes dysplasia to become carcinoma in situ to invasive carcinoma. I will explain this. So what I have drawn here is the basement membrane. Dysplasia, I explain this word. Dys means disordered growth of cells. It could be mild dysplasia or moderate, and if it is, and if you remove the stress, or if our body manages to destroy these cells, remember, our body will attack tumor cells. So if that happens, it is reversible. But the moment it becomes a carcinoma in situ, these cells no longer have the normal functioning. Their only goal is division. So they will grow inside. Carcinoma in situ is basically carcinoma on that side. However, these tumor cells will release enzymes such as collagenase and hydrolase to break through the basement membrane, and they become invasive. Now, between cells, you have these adhesion molecules. There's an adhesion through these molecules called cadherin. So if invasion occurs, usually the cadherin is destroyed. There is no more connection between the tumor cells, and they can spread to new sites through blood, invasion, or through lymph. Local invasion or lymph, sorry. Next, we are going to talk about benign tumors. What is a benign tumor? Tumors that do not invade, that you can consider it not to be dangerous. Okay, so tumors, when we talk about tumors, we are going to talk about two cell origins. First is epithelial cells or mesenchymal cells. This is the same for both benign and malignant. I need you to know what epithelial cells and mesenchymal cells are. So let me take this. First, you get epithelial cells. I said in a previous lecture, there's 4 types of tissues. One is epithelial tissue, connective tissues, muscular tissue, and nervous tissue. So for the sake of learning tumors, we combine connective tissues, muscular tissue, and nervous tissue and classify it under mesenchymal tissue. We call those three together mesenchymal tissue. And this is important. Can skeletal muscles undergo tumor growth? It cannot. Cardiac muscles? No. But smooth muscles can. And nerves, same concept. It's not the nerves that undergo tumor. It doesn't undergo the formation of tumor. It can't grow new cells. Instead, you have the supportive cells like glial cells, which are the ones that are going to form the tumor. Now let me explain these cells again. So this is all histology. I'm going back to basics. So first we have the basement membrane. And on top of that you get the epithelial cells. These include glandular epithelia and other epithelia that secretes mucus, squamous epithelia, columnar epithelia, pseudostratified epithelia, transitional cell epithelia, and below the basement membrane, this is the basement membrane, these are epithelial cells. You have connective tissue. The most common type of connective tissue is areolar tissue. Now, what is connective tissue? As the name says, it connects parts of the body. The best example, blood connect. Blood connects the whole body with each other. Blood is a type of connective tissue. Bone is a connective tissue. And there's three types of constituents in connective tissues. One is cells, such as red blood cells, and in areolar tissue you get fibroblasts. In bone tissue you get osteoblasts, osteoclasts, osteocytes. Fibers, collagen, hyaline fibers, elastin, and the matrix, the groundwork, the base. So fibroblasts releases fibers such as collagen, elastin, etc. So that is what tissues are. And I need you to understand this because we are going to talk about tumors that originate from epithelial tissues and from mesenchymal tissues. So first we are going to talk about benign tumors that arise from epithelial cells. We are going to talk about two types of benign tumors. One is adenoma. Adeno, I told you, means glandular. It could be glandular epithelium ducts or acini. These can secrete, but there's no conduction pathway. They can't. In most tumors, you don't get a conduit. So basically, what is released is going to be within the capsule, and the tumor is going to grow because of these secretions. First, fibroadenoma. Fibroadenoma, the most common location is in the breast. This, as the name says, fibers are secreted in the breast lobules, and you get a mass like this. Next, cyst adenoma. Now this is a very common type of tumor in the ovary. Remember this tumor has a capsule, and inside it what I drew in orange is the tumor cells. They secrete. They're going to secrete fluids. So the fluid that is secreted cannot leave the capsule. It's going to be within the capsule. So what happens is this fluid will accumulate in the glandular lumen. They will become big and merge to form a large cyst. The next type is pleomorphic adenoma. Pleomorphic. Not one cell type, you get different cell types, and you get it in the parotid gland. This is a tumor which grows here. and it does not grow as a single, let's say, a ball like shape. It grows in a very variety of shapes. So you get different cell types which are involved. You get mucus cells, you get cartilage formation, grows rapidly. This is important. It grows very rapidly, and even after, if you remove it, it can recur again, and it has a high chance of becoming malignant. Next, we have polyps, polypus adenoma. This is seen in the colon and the rectum. Very easy to become malignant, and a very useful health advice is to eat fibers to avoid. Now, papillomas. I talked about this earlier. Papilloma is, it grows on this, it's just prominences on the tumor, usually inside a lumen. These are finger-like or papilla-like, and is connected to a pedicel, that is basically the trunk. Next, we have tumors that arise from mesenchymal cells. Now, fibromas are tumors usually you get on the limbs. You get it on the arm, on the legs, and these are tumors that arise in subcutaneous tissue. So if you remember histology, you should know subcutaneous tissue is the tissue under the skin. Under the epithelial layer, you get the dermis, and below it you get the subcutaneous tissue. So it grows, this is obviously fibers which grow. These are nodular. You get it as a nodule, something like a ball like this. It's grayish white and firm, but you can move it. You can move it around. I don't know if you can see this. I feel like I have something like a fibroma, or it could be a myositis ossificans situation after a trauma, but I can move this. So it grows slowly and does not recur after removal. Lipoma. You get it on the back, shoulder, neck, and proximal limbs. What you need to know about this is, these are yellow, soft, and with a capsule. So when you remove it, you can see it's yellowish and it's very soft. And you can actually, if you have a growth, you can feel it by feeling a very soft mass. You can press on it and you can feel a very soft mass. It's rarely malignant and the sizes vary. Next, angioma involves blood vessels. So if it involves the blood vessels of it's called hemangioma, and this is a very common, this is more common than involvement of lymph vessels. You get it on faces of children and liver, which is more common. There is infiltrating growth. There is no capsule. You cannot differentiate the growth, but it's basically on skin. It grows like this. And the other type is lymphangioma, lymph vessels. Now, as I said, it shows infiltrative growth. This is infiltrative growth. This is not exophytic type growth. And finally, leiomyoma. Now, what I have drawn here is, I need you to understand, this is not on the surface. It's not an epithelial cell tumor. We are talking about tumors arising from mesenchymal cells. So the growth is inside. And what is leiomyo? We are talking about smooth muscles. Remember, skeletal muscles and cardiac muscles cannot form tumors because they cannot grow, they can't form new cells. Smooth muscles can, and this is common in the uterus as simple, that is a single mass or multiple mass tumors. Okay. Next, we have malignant tumors, and the one thing I need you to remember, literally, when it comes to tumors, I just need you to remember this fact. Carcinoma means it's epithelial origin. It originates from, if the word ends with carcinoma, it means the tissue origin is epithelial. But if it ends with the word sarcoma, it is a mesenchymal cell origin. This is very important. Like I said, we are talking about either epithelial cell origin or mesenchymal cell origin. So carcinoma, this is basically we are studying cancer. Carcinoma is the most common type of all tumors, and you get carcinoma nests in microscopy of highly differentiated tumors. You get a clear border, and obviously because it's a cancer, it spreads. Remember the structure carcinoma nests, because for the pathology practical exam you need to be able to recognize this. The growth types could be polypus, fungus-like, or cauliflower. On skin you get necrosis and ulcer on the surface, and over here I'm talking about the growth patterns, how it spreads. So let me explain this again. So the tumor will first infiltrate its origin tissue. Like I said, it could first start as a carcinoma in situ and it can invade downwards, or it could be an ulcer. Whatever it is, it's first going to show infiltrative growth. Next, most commonly, you get lymphatic spread. It will grow down towards lymphatic vessels, and it will spread into lymph nodes. Lymph node metastasis is very common in breast cancer, because as you know, all around the breast you get a lot of lymph nodes, lymphatic tissue. Next, it can spread into blood. This is called hematogenous spread. I need you to understand the three types of growths. One, infiltrative growth. It infiltrates the origin tissue. Next, it can enter lymphatic vessels, enter lymph nodes, and finally it can enter into blood vessels. Usually that's the order in which it happens. First you get infiltrative growth, next lymphatic spread, next hematogenous spread. So the first type of carcinoma we're going to learn is squamous cell carcinoma. Remember, try not to memorize the locations. You just need to know the areas where you get squamous epithelia. This is basic histology, and usually it's the opening areas. So it's the skin, mouth, esophagus, larynx, and again the cervix, vagina, penis. Those openings are covered by squamous epithelia. These are the type of tissue that undergoes squamous cell carcinoma, and as I explained, Barrett's esophagus can lead to squamous cell carcinoma, but it's only a 1/3 chance. It is more common to be an adenocarcinoma. This is very important for MCQs. There's a 2/3 chance that it is a type of adenocarcinoma. Bronchi, kidney can undergo metaplasia, even though they are not lined by squamous epithelia. They can undergo metaplasia to become squamous cells, and these can undergo dysplasia and lead to squamous cell carcinoma. Next, adenocarcinoma. You get this in glands. Glandular tissues will undergo adenocarcinoma, and you get glands in the gastrointestinal tract, breast, thyroid, uterus, pancreas, etc., wherever it is. And a type of structure you need to identify for pathology practicals is signet ring carcinoma, where you get a cell that is going to look like a signet ring. So you have the cell, and the nucleus is very prominent on top, on one side of the cell, like this. This is what you call a signet ring carcinoma. Next, we have basal cell carcinoma. This is more common in older people, especially on face, locally invasive, but rarely spread from its origin location. See, it's a basal cell carcinoma, that is the cells on the basement membrane, the, let's say in simple words, the germ cells, the epithelial cells on the basement membrane can start growing uncontrollably, and usually you get a lot of bleeding and ulceration, but this is rarely metastatic, responds well to radiotherapy, and this is important, very low malignancy, do not spread to other organs, no, and do not show crazy growth. Finally, transitional cell carcinoma. Now, what are transitional cells? You get them in the bladder, ureter, or renal pelvis. So why do you need this type of cell? Urine comes into the bladder. The bladder needs to stretch. So the type of cell that allows stretching is called transitional cells. And I drew a cell, not a cell, the tissue. But basically, a hallmark of transitional cells is something called ghost cells. They have two nuclei. You don't need to know this for tumor, but this is just an interesting fact. And is usually associated with coloring dyes, because usually excretion, you inhale coloring dyes in textile industries, and excretion is going to go through the bladder. These dyes are carcinogenic. They can touch the surface of the bladder, and these cells are more, how to say, so as I was saying, these cells are this type of cancer is associated with coloring dyes, where the dyes will touch the surface of the transitional epithelia, and these epithelial cells are more susceptible to damage by dyes, so they can undergo cancer formation. Next, we have tumors, malignant tumors, which are of mesenchymal cell origin. These are called sarcomas. Very common in youth, can be nodular or lobulated, grows rapidly, wet and fish-like. Hematogenous spread is more common. You get spread through blood and well spread across tissues. See, these are mesenchymals. This is not, we are not talking about this type of tumor. It's not epithelial cells where it has to invade through a basement membrane, usually passing lymph into blood. You find it in the tissues. So as you can see here, it can directly spread into blood. Okay, get it within tissues. First type, fibrosarcoma. You get it as two types, and like I said, there's two types of tumor growth: well differentiated or poorly differentiated. If it is well differentiated, it is going to grow slowly, because you need to give it time to differentiate, to form more of a normal cell. So its main goal is not to spread to other organs. Therefore, they rarely metastasize. But I need you to understand this. These can recur. You remove the tissue, but it grows again. Next, you have poorly differentiated. Their only goal is cell division. So they will grow rapidly, easily spread to other organs, and can recur. And what is this type of tissue made of? Fibers. Next, you have liposarcoma. Similar concept to lipoma, basically grows in legs and peritoneum and is malignant. Leiomyosarcoma. Remember leiomyi? Smooth muscles. Smooth muscles you find in the uterus, in small intestine, and the stomach can undergo this type of cancer formation. And next, osteosarcoma. Osteo involves the brain, the bone. And this is the most common type of bone neoplasm. You get this more commonly in teenagers in the long bones of limbs. This is a very highly malignant tumor, can metastasize to lungs, and can show necrosis and hemorrhage. I explained how necrosis happens. Hemorrhage, also a very similar concept. So basically, you get the tumor growing and it can invade into the cortex. So you get an outgrowth like this, and when the blood supply is cut off, let's take the ends of it, blood supply. So if the oxygenation is not enough, the cells here will die, undergo necrosis, and the blood vessels will also break down, causing release of blood, leading to hemorrhage. So tumor classification. Now, it's basically how you define tumors. So next, tumor classification. How you classify tumors, either as benign tumors or malignant tumors, and in between those two you get borderline tumors. It can go to become malignant or not. So benign tumors, these are confined growths, usually cause pressure injuries. They can grow into large sizes. Like if this is the way a normal person looks, it can grow into a very large size. Malignant tumor is what you call cancer. Spreads from site of organ and shows pathological mitosis. Only main function is growth. Misnamed tumors. There are some tumors which are malignant but have been given the ending oma is the suffix for benign tumors. For example, melanoma, lymphoma, hepatoma, seminoma. When you say semi, it involves the seminal vesicles, testicular tumor. Carcinosarcoma is a tumor that is composed of both carcinoma and sarcoma. It involves the epithelial cells and the connective tissues or the mesenchymal cells. Next, you give a surname to the person, to give credit to the person who found the tumor, such as Hodgkin's lymphoma. You add a name in front of the type of tumor. Omatosis, such as fibromatosis, lipomatosis, angiomatosis, these are get multiple growths of benign tumors. Next, we have some tumors which you need to just know. Blastoma are tumors that derive from the embryonic germ layers. Now, if you remember, there's 3 germ layers: the ectoderm, mesoderm, and the endoderm. So most of these are malignant. You usually get these in infants, before, not infants, sorry, in the fetus. So on ultrasound scan, you can see an abnormal outgrowth. And there was a recent case where a doctor took out the fetus, operated and removed the tumor, and put the baby back in to the mother. Then haematomas, these are tumor-like masses, but these are not cancerous, these are not neoplastic, there's no cell division. It's composed of a mixture of tissues normally found at the site. This is the original site. If it is in the thyroid tissue, and these grow slowly with the host. Tumors of multiple tissues, and teratoma is the most interesting example. So it involves all 3 germ layers, and usually you get it in the ovary or spermary. If it is in the ovary, it is benign. Spermary, it can be malignant. Now, how is a teratoma? What does it look like? Usually, a teratoma is basically the ovum will start to differentiate. It will try to form a baby without being fertilized. So on the tumor, you can actually see eye growth. You can see something like an eye, a primitive eye, or hair, or you can even see teeth. So I'll show an example for that. I'll actually show it right now. This is a teratoma of ovary. You can see the teeth, you can see the eyes, and you can see here. Next, tumors arising from the neuroectoderm. Remember, nevus, I'm not going to go into detail here. It is from melanocytes, and these can form melanoma. They can differentiate into melanoma, which is a highly malignant tumor that produces melanin. Arise mainly from junctional nevus. It's basically a black color mass, something like a birthmark, a large birthmark. It's black in color. Next, we have atypia. So what is atypia? How atypical a tumor is from the normal tissue, from its site of its location, how atypical those cells are. So if it's mildly atypical, I just drew some diagrams just for you to understand. If it is mildly atypical or mild atypia, it means it's a well differentiated tumor. It looks very similar to the normal cells, and it can probably do the same functions as the normal cell. But if it is highly atypical, then it tends to be more malignant, because it's less differentiated, and it is therefore more dangerous. Next, polymorphism of tumor cells. Several types of morphology. We take the nucleus to the cytoplasm, the ratio. In a normal cell, the nuclei to cytoplasm ratio is 1:1. But in malignant tumors, you get a larger cytoplasm with a nucleus to cytoplasm ratio of 1:4. And in the nucleus, you can see mitotic bodies and a very prominent nuclei, not just one, it can be 2 or 3, because their function is just growth. So again, types of growth, I explained this, can be expansive growth, infiltrating growth, or exophytic growth. Effect of tumor on host. Benign tumors, I explained all these, but basically it is usually well differentiated. I'll give you an example. There's a type of benign tumor that releases the hormone PTH, parathyroid hormone. Now usually it can go anywhere, but let's say it grows in the lungs. So what happens is, these patients, the common presentations is going to be, this patient is going to get kidney stones. Why? Calcium levels in blood is very high. Now what does the parathyroid hormone do? It is released by the parathyroid glands. There's 4 parathyroid glands behind the thyroid gland, and they release parathyroid hormone to break down bone to release calcium and phosphate into blood. So when calcium levels increase in blood, during excretion through urine, there's going to be salts formed and cause the formation of kidney stones. So in this type of tumor, this is a benign tumor which you find in the lungs. So this patient will come to the clinic saying he or she has pain in the abdominal area, lower abdomen, and when you do an ultrasound scan, you see there are stones. You remove the stones. You check the blood calcium levels, you can see it's high. You remove the stones, and after a certain time it recurs again. So what you need to do next is, you need to search for a benign tumor which is releasing parathyroid hormone, because you check the parathyroid glands first and you find they're normal. So what's the most likely cause? It could be high intake, or it could be because there's a benign tumor which is secreting parathyroid hormone. This is a very common thing in tumors. Grows slowly, no metastasis. Main form of damage is it presses on adjacent structures. Malignant tumors, these are non-differentiated. They grow fast. Their only goal is pathological mitosis and can spread to other organs. So local effects. What is local effects? within the tissue. Within that tissue, usually you get bleeding, you get necrosis. Secondary infections mainly due to immunodeficiency. So what happens is our body tries to attack the tumor to get rid of it, but it cannot. It's going to waste all the resources on this, and in the end, when another infection happens, there's nothing to fight the infection. So you can get secondary infections, and obviously pain and destroy function of the organ. Pain because it grows inside the body. It's going to cause pain. Systemic effects, that is, you take the whole body, the entire body as a whole, and you get symptoms like anemia, fever, cachexia. This is important. The tumor needs nutrition. So what it does is it's going to take all the nutrients it gets and grow. It's basically you're wasting away the body. And a condition called paraneoplastic syndrome. I'll explain that. So this is a type of tumor, a well-differentiated tumor, in which there's going to be hormone production. Now I talked about one hormone production, that was PTH. Another type of hormone production tumor is if it is going to perform the function of beta cells in pancreas. So what happens then is so I explained one type of hormone production by tumors. Another type is if the tumor takes on the function of the beta cells in pancreas and release insulin. It will release so much insulin, it's going to cause a condition called increased insulinemia. When you add emia, it means in blood. So hypoxia is not in blood. Hypoxemia. Hypo, low, oxygen, in blood. So just understand that suffix. So what happens is this tumor is going to produce so much insulin that the blood sugar levels are going to drop so fast, and the patient can go into a coma and the patient can die. Next, cancer cachexia, that is due to loss of body fat and lean body mass. Basically, you look sick, you look like a bone, you look like a skeleton, and you have profound weakness, anorexia, no appetite, and anemia. The main reason is this substances released from our inflammatory response, our body's immune response, such as TNF and interleukin 1. They are going to suppress appetite. But basically, another reason is the tumor cell needs all the nutrients to grow. Next, I'm going to explain what is paraneoplastic syndrome. Here are some examples: hypercalcemia and Cushing syndrome. Now, what is the function of a tumor? It grows. Its function is going to be either pressure damage or infiltrating growth, basically growth. Paraneoplastic syndrome are syndromes which cannot be explained by the tumor growth. What does that mean? So a tumor will grow, it will cause pressure damage, it will cause infiltrating growth, it can cause necrosis in varieties, there can be hemorrhage, but you don't expect that tumor to release calcium, to increase the calcium, that is, I explained, parathyroid hormone, or again the hyperinsulinemia condition. Usually you get this in well differentiated tumor, but basically paraneoplastic syndrome are these. What you don't expect the tumor to do, but because of the tumor, you get these happening. Examples: hypercalcemia, Cushing's syndrome. Again, a tumor function is just growth. But paraneoplastic syndromes are syndromes which cannot be explained by the tumor growth, such as hypercalcemia, hyperinsulinemia, and Cushing's syndrome. Next, what is dysplasia? Disordered growth. So I explained this. It can go from mild to moderate to severe to carcinoma in situ to invasive carcinoma. And finally, there's something called precancerous lesions. These have the tendency to become malignant. And usually the question will involve an answer that does not include the small intestine. That will include the small intestine. But if you look here, none of these answers, none of these items in the list involves the small intestine. So usually that's the answer. So first type is leukoplakia, that involves the mucosa of the oral cavity, where you get melanin deposits. Cervicitis, chronic cervicitis and cervical erosion that can lead to cancerous growth. Proliferative fibrocystic changes of breast, adenomatous polyp of large intestine, chronic atrophic gastritis and gastric ulcer, chronic skin ulcer, and chronic ulcerative colitis. Just remember these, you need to memorize these. So again, this is basically a revision, but basically we're going to talk about benign tumors of epithelial origin. This is an ovary and you can see the cysts. You can see the fluid filled cavities. Pleomorphic adenoma. As I said, it's not just one type of tissues, it's going to cause an abnormal growth. Fibroadenoma, polypus adenoma, and a papilloma. You can get this on the penis. On the penis, if this is the penis, you can see a growth like this. Next, benign tumors of mesenchymal origin. Fibroma, what I said, can be it can be a large bump, small bump, and you can move it around. Lipoma, it's usually soft. Hemangioma, as you can see, there's no clear border. There's no clear border. This is growing, see, it's infiltrative growth. And leiomyoma. Leiomyoma, this is the uterus. You can see the growth. You can see that. Squamous cell carcinoma, I told you, you need to know what cancer nests are. Basically, it's in well-differentiated tumors and you get keratin pearls, and intercellular bridges can also be found. Those three you need to know. Signet adenocarcinoma, I told you a type is signet cell carcinoma. You can see the cell and you can see the nucleus. There's several here. And this is a basal cell carcinoma, you get it on the face. Transitional cell carcinoma is, it involves dyes. Malignant tumors of mesenchymal cell origin. Mesenchymal cell origin. Fibrosarcoma, liposarcoma, leiomyosarcoma, and osteosarcoma. So that's it for tumor. There are some questions which you should be able to do. These are some PPT questions. 1. Leiomyoma most often occurs in the uterus. It involves smooth muscles. Epithelial tissues. Papilloma. I'm not going to give the answer for the third one and the fifth one because the question is a bit confusing. The university will give the answer for those, the teacher teaching this. Carcinoma and sarcoma, a main distinction is carcinoma nests. Pathological characteristics of cancer, cell ATPI is apparent. it is not the normal cell. That is basically what you look for in a slide. In a histological biopsy, you check for that. Intercellular bridges and keratin pearls, highly differentiated squamous cell carcinoma, which is not a precancerous lesion. Like I said, small intestine related answers. High differentiation of tumor cells is that it is similar to the original tissue, which is the most important sign of malignant tumors. Not just mitosis, because mitosis you get everywhere. Red blood cells, the bone marrow produces new cells, skin, spermary, sperm production. No, sorry, that's meiosis, but then there's a certain amount of mitosis involved there too. Pathological mitosis is the answer. Hemangioma does not have an envelope. The mesenchyma, the stroma, is basically the supporting structure that contains blood vessels and connective tissues. And there was another question, which tumors are seldom metastatic? The answer was basal cell carcinoma. There was this part which I missed. I'll quickly do that. That is tumor staging. Now, tumor staging is of two types. One is the grade of the tumor and actual staging. So, what is the grade of tumor? This is related to atypia. This is the degree of cell differentiation and mitotic activity on histology. You get low-grade tumors which are well differentiated. So, in other words, less dangerous compared to high-grade tumors. These are more atypical, poorly differentiated, or anaplastic. That is basically the same thing as atypia. Next, we have staging. The system we most commonly use is called the TNM stage system. T stands for tumor size or the invasiveness. That is within the tissue, how big the tumor is. So usually we give it a grade from 1 to 4. N is if there is node metastasis. If the tumor has entered into a lymph node, you can see here. And M is called metastasis. That is, it has spread to another organ. So N and M, the value ranges from 1 to 0. If it is 1, that means node metastasis has occurred, or metastasis has occurred, sorry. If it is 0, it means there is no node involvement or there is no metastasis to another organ. So if you are to compare these values, you can decide which is the most dangerous situation, which is the least dangerous, just using these tumor grade values. So the first one, you get a T value of 3, N value 1, M value 1. It is not as dangerous as 2. Because as you can see, the growth is more. The value is higher in T. The third one, you get no metastasis or no node involvement. Therefore, it is less dangerous. But when you compare 2, you can see there's metastasis. When you compare the fourth one, you can see there's metastasis. So the order will be like this.